Hey everyone, it's Adam Farkas here again with you at SECO 2018 and along with Dr. Sheila Morrison. And we're going to be talking a little bit today about scleral contact lenses. So what is a scleral lens?
So a scleral lens is, it's a larger than a soft lens, gas permeable lens material, lens that vaults over the entire cornea. So typically, it will land on the sclera. It contains a fluid reservoir that bathes the eye in fluid during wear. So I like to kind of explain it sometimes. It can be kind of like a spa for the eye, right? With our ocular surface patients that have, ocular surface disease, that's one way they can relate to that fluid that's between the lens.
Right.
The benefit of vaulting that cornea in, twofold. So if we have an irregular surface that kind of prohibits good, clear optics, vaulting over allows the tear lens to neutralize the optic, giving good vision for the patient. Secondarily, in ocular surface disease, we can kind of buffer and smooth over some of those defects and scars and things like that. Again, ultimately creating a clear window for the patient to have better vision than they would without the scleral lens.
Right, and in fact, we just spoke about amniotic membranes a moment ago, right? And I was kind of thinking, I know some people like to use scleral lenses in conjunction with amniotic membranes.
We do, yeah, and I mean the goal of an amniotic membrane really is to regenerate. And so we're trying to promote healing without scarring. And in my practice, to get that eye to a stable point, where in a lot of cases, a scleral lens is a treatment, a long-term treatment that we would use to maintain that healthy ocular surface. So the amniotic membrane will give that boost where we can get the surface to be at a level where it could tolerate a lens.
Right.
And then the maintenance and protection comes from a scleral lens.
And so if someone wants to get started with sclerals, they're a little bit scared, they've never done it before, what kind of advice would you give to get started?
I mean, the first thing I would do is I always like to remind people that scleral lenses, we do have, anyone could fit them, essentially. We have a lot of options, we have a lot of resources. We have to remind ourselves they are a medical device. And so the first thing I would do is to use them responsibly and take the time to get the training that allows you to really understand what we're dealing with, especially when it comes to some of our more severe ocular surface disease patients. There are resources that are really amazing. So I would utilize, groups like the GPLI.
Sure.
They have online resources, ongoing education happening in all areas of specialty contact lenses. The Scleral Lens Education Society is a great resource that does promote education in scleral lenses globally. And so tapping into some of those groups would be a great way to get connected to learn about the workshops available at our conferences.
Yeah. And Jeff Sonsino once told me something that stuck with me. He said, if you can fit a scleral lens properly, you will never have a more loyal or dedicated patient in your life. They will follow you to your grave.
Oh my goodness. If you're able to be that person that takes it to the next level and really help them with a scleral lens, for example, where other modalities such as glasses or lenses had failed them, you're their hero and they are not going anywhere. You're going to have that patient for life and you're going to have their family members and their colleagues coming to see you as well.
Right, great. So I hope we piqued everyone's interest in take a look at sclerals. I think they're a good fit for a lot of folks. So thanks a lot, Sheila.
Yeah, thank you for having me.